Whiplash is a common injury. It often happens during car accidents. Even a minor fender bender can cause it. Your head suddenly snaps forward and then it quickly snaps backward. This movement is like the crack of a whip. The neck's delicate structures are not designed for such rapid force. This unexpected trauma can set the stage for issues that may not fully appear for years, acting as a silent countdown to future spinal problems if not addressed. Immediately after a whiplash event, you might feel several symptoms. Neck pain is very common. Stiffness often accompanies this pain. You might also experience headaches. Some people report dizziness or a ringing in their ears. Pain can also radiate into the shoulders or down the arms. Sometimes these symptoms start right away. Other times, they can take hours or even a day or two to develop fully, making it crucial to pay attention to your body. Beneath the surface, the initial damage can be more extensive than you think. Tiny, microscopic tears can occur in your neck's muscles and ligaments. The facet joints, which guide spinal motion, can also be injured. Sometimes, the nerves in your neck can become irritated or compressed. Your body naturally responds with inflammation. This is part of the healing process. However, this initial damage is the critical first step in a potentially long journey of spinal changes. It is important to understand that whiplash is more than just a temporary pain in the neck. An early and thorough medical assessment is truly essential. Some of the damage caused by the forceful movement might not be immediately felt. These hidden injuries can form the unfortunate basis for more serious, long-term degenerative problems in your spine. Ignoring early signs or assuming it will simply go away can be a mistake. Taking it seriously from day one is key. The initial trauma from whiplash can unfortunately start a slow cascade of degenerative changes. Your body tries to heal the injured tissues. However, this healing process is not always perfect. Scar tissue might form, which is less flexible than healthy tissue. The biomechanics of your neck, how it moves and bears weight, can be subtly altered. This can lead to increased stress on your spinal discs and joints over time, silently wearing them down. One common degenerative change is called disc desiccation. Think of your spinal discs as small, jelly-filled cushions between your vertebrae. These cushions need to be plump with water to do their job effectively. They absorb shock and allow movement. Trauma, like that from whiplash, can disrupt their nutrient supply or directly damage them. This can cause them to lose water content over months or years. As discs desiccate, they become flatter, harder, and less able to cushion the spine. Another problem that can arise is an annular tear. The outer layer of a spinal disc is a tough, fibrous ring called the annulus fibrosus. It contains the softer, gel-like center, the nucleus pulposus. The violent forces of a whiplash injury can cause small or large tears in this outer annulus. These tears can weaken the disc structure significantly. Over time, these tears might not heal properly. They can become a pathway for the disc's inner material to bulge or even herniate, potentially pressing on nerves. These changes often fall under the umbrella term cervical spondylosis. Cervical spondylosis is a general term. It describes age-related wear and tear affecting the spinal discs and joints in your neck. However, a significant injury like whiplash can accelerate this process dramatically. It's like fast-forwarding the natural aging of your spine. This can lead to the formation of bone spurs, known as osteophytes, and a narrowing of the disc spaces, contributing to chronic neck pain and stiffness much earlier in life. Medical research plays a crucial role in helping us understand these long-term consequences. Scientists conduct studies that follow whiplash patients over many years. They often use advanced imaging techniques. X-rays can show bone changes. Magnetic resonance imaging, or MRI, is excellent for visualizing soft tissues. These include muscles, ligaments, and spinal discs. This research provides critical evidence of how injuries progress and what changes occur silently inside the spine after the initial whiplash event. Studies by researchers like Yoganandan and colleagues have provided valuable insights. Their work often focuses on the biomechanics of whiplash. They investigate how the forces during an impact affect the different structures in the neck. This research highlights the vulnerability of the spinal discs and the small facet joints. Importantly, these studies suggest that significant injury to these soft tissues can occur even in what might seem like low-speed collisions, setting a path for later degeneration. Further evidence on timelines comes from researchers such as Taylor and Twomey and Pettersson et al. For instance, a study by Pettersson and colleagues published in 1997 looked at patients 10 years after their whiplash injury. They found that degenerative changes in the cervical discs were significantly more common in the Whiplash group. This was compared to individuals who had not experienced such an injury. Taylor and Twomey also documented post-traumatic changes, indicating that osteoarthritis and disc lesions can develop years after the initial trauma. When doctors use MRI scans to look at spines years after a whiplash injury, they often see specific degenerative changes. Reduced disc height is a common finding. Disc desiccation appears as darkened discs on certain MRI sequences. Annular tears may be visible. Bone spurs or osteophytes can form along the edges of the vertebrae. Arthritis in the facet joints is another frequent observation. MRI is therefore a powerful tool for identifying and documenting these silent degenerative processes. Several factors can influence who is more affected by spinal degeneration after whiplash. A person's age at the time of injury plays a role. Older individuals might already have some pre-existing wear and tear in their spine. The severity of the whiplash injury itself is also a major factor. A more forceful impact generally leads to more initial damage. This provides a greater foundation for future degenerative changes to build upon. Pre-existing spinal conditions can also make one more susceptible. Lifestyle choices can also impact how your spine recovers and ages after whiplash. Poor posture, for example, puts continuous strain on your neck and back muscles. This can exacerbate any underlying instability or damage. Smoking is known to impair healing processes throughout the body. It can reduce blood flow to the spinal discs, hindering their ability to repair. Similarly, a lack of regular, appropriate exercise can lead to weaker supporting muscles, making the spine more vulnerable to further issues. This is why early documentation and diagnosis are so clinically relevant. If you have been in an accident, seeing a healthcare professional promptly is very important. Getting an accurate diagnosis of the initial injuries is the first step. Documenting these changes through imaging, if indicated, provides a baseline. This baseline can be invaluable for tracking any progression of spinal degeneration over time. It helps your doctors to understand the trajectory of your condition and to guide treatment effectively. In conclusion, early intervention and continuous care are paramount. Whiplash should not be dismissed as a minor event that will simply resolve on its own. Physical therapy can be very beneficial. It can help restore range of motion, strengthen muscles, and improve posture. Pain management strategies may be needed for some individuals. Lifestyle adjustments, such as regular exercise and maintaining a healthy weight, can support long-term spinal health. Attentive, proactive care can help manage and potentially slow the silent degeneration that whiplash can trigger, preventing more severe problems down the road.